The Nigerian government have expressed concern about the disruption unleashed on the nation's healthcare system since the onset of COVID-19, which has resulted in a significant drop in the number of outpatient population of non-COVID-19 ailments in hospitals nationwide. Now, the government said the data showed a 50% reduction in the number of outpatient cases from 4 million people to 2 million people, while antenatal patients slumped from 655,000, or rather to 655,000 from 1.3 million, and immunization figures also halved. Speaking at the media briefing by the Presidential Task Force on Control of COVID-19 in Abuja, the Minister of Health, Dr. Osagie Ehanire, said the country's health sector have witnessed some drawbacks due to the outbreak of the virus. He said that this is based on reports that hospitals, both public and private, have been rejecting patients since the onset of the pandemic over the fear of their health workers contracting the virus from patients. Meanwhile, Nigeria has recorded 193 new cases of COVID-19, bringing the number to 5,162 now. That is our total number of confirmed cases in the country. Announcing this last night, the Nigeria Center for Disease Control said that Lagos have recorded 58 new cases, Kano 46, Jigawa 35, Yobe 12, the Federal Capital Territory 9, Ogun 7, Plateau and Gombe 5 each, Imo 4, Edo, Kwara and Borno 3 each, while Bauchi, Nasarawa and Ondo have 1 new case each. It also said the 1,180 people have now been discharged, and unfortunately we have recorded 167 deaths. So, Doctor, quite a mouthful there. The latest breakdown with regards to the COVID-19 situation in Nigeria, our situation report, if I may call it that. The federal government have expressed very valid concern over the decline in the number of outpatients visiting hospitals. And I think this is also a good time to mention that a lot of hospitals have also started to adopt telemedicine practices to try and fill that gap. But it's still not enough, because the numbers that we're seeing here, 4 million to 2 million, is a drastic decrease.
Well, maybe there will be telemedicine in some privileged parts of Nigeria. But the majority of the people are in rural areas. They are in poor parts of the cities. Yeah. And it's, good to raise concern about the fact that people are no longer going to the hospitals. Now, it's not enough for the Minister of Health to express concern about this. The thing is to do the research, to find out what is happening, and to make sure that in the face of COVID-19, basic, essential medical services that the people should have access to, do not stop in terms of outpatient ratio. And we just hope that these figures that he has given, that they are actually accurate, although he says it's from the National Health Management Information System. Yeah. So we want to give them the benefit of the doubt. Maybe there is a lot more that needs to be done in terms of sensitizing people. But I do know that a lot of people, when they hear COVID-19, they think that they should just stay away from the hospitals so that they don't go there and they check their temperature, and they get taken in.
Or the fear of going there and catching the virus by being in the hospital.
That's another part of it. Mm-hmm. That is one. But other issues also came up yesterday at the briefing. The point about the Amajiris.
Yes.
The Ministry of Education, the Minister of State for Education, participated in the briefing yesterday. And he was saying that the federal government is going to partner with state governments in the northern part of the country to make sure that the 157 Amajiri schools set up by the Jonathan administration under what was called the Sangaya scheme, that those schools are really activated, and that the children, the Amajiris, the out-of-school children, begin to take advantage of these schools. And I think that's in order. It's just unfortunate that it's now COVID-19 that is compelling the Ministry of Education to begin to talk about this. We hear, large population of, out-of-school children in the northern part of the country. And as I've said previously on this program, what the northern governors need to do, apart from expelling or repatriating Amajiris, is to see how those kids, their future can be better planned, and they can be reintegrated into the system.
Exactly.
Meanwhile, the Nigerian Medical Association has also had cause to complain about some of the things that government has done so far. They think that, yes, Nigeria has done over 30,000 tests, but they do not think that the method that is being adopted by the federal government is good enough. what the federal government calls smart testing.
Yes.
Now, instead of making that into a big argument between the medical association and the federal government, I think that the NMA should engage the federal government.
Yeah.
If they have any specific ideas, they should come up with those ideas. They are also opposed to the idea that Nigeria will adopt what it calls home care treatment. Now, the argument of the Nigerian Medical Association is that given these kind of housing facilities that we have and the overcrowding in many communities, caring for COVID-19 patients at home could, in fact, increase the rate of community transmission. And again, I think this shouldn't be too much of an argument. They should engage as professionals.
Yeah.
And three, I think another thing we can avert our minds to is what is happening with Nigerians in Thailand who want to return home, who want to be evacuated. Now, we're told that the mission, the Nigerian mission in Thailand has negotiated the rates. And anybody who wants to be repatriated from Thailand will have to pay as much as 297,000. Now, some people are protesting that this is really on the high side.
Yeah.
I've always argued that the federal government should provide support if it can. But the position of the mission is that, well, if you don't pay, then nobody will be repatriated.
And it's quite sad because, like the other day when we had a guest on the show that came on to discuss what Nigerians in India are going through, what you can see here is there is definite need for the government to assist more than they are doing, and what they are doing now is not enough. But Doctor, before we move on to another story, just to add to your breakdown as well, another thing that was mentioned yesterday that I think is important to raise is the lack of manpower in Kano that the Minister of Health, Dr. Osagie Ehanire, mentioned at the Presidential Task Force briefing and brought up, and that is of serious concern, especially given the high case rises that we're seeing in Kano right now, and I think that we should shed a light on that. But we will move on to another story today. The Nigeria governors have raised concern over the ownership and distribution of recovered lucid funds as a first-line charge from the Federation accounts. They also urged the National Assembly to step down on the controversial Infectious Diseases Control Bill to give room for consultations with states and other stakeholders. However, the chairman of the Senate Committee on Media and Public Affairs, Senator Ajibola Bashiru, told our sister outfit this day that rather than seeking suspension of further legislative action on the contentious bill, each governor should dialogue with his senators on the objection to the bill. In a communique issued on Thursday after a virtual meeting held on Wednesday, the governors, under the auspices of the Nigeria Governors Forum, said the arrangements of all Federation-funded investments should recognize state governments as shareholders in the distribution of proceedings and decision-making. Doctor, what's your take on this?
Well, I mean, the governors have been holding meetings, the Nigeria Governors Forum, and what they've been doing is virtual conferencing, teleconferencing, which I think is one of the major fallouts of social distancing and physical distancing in the time of COVID-19. One, their point about recovered loot. Now, usually, you know, governors in Nigeria, they have this sharing mentality. They are trying to lay claim. I think they should be reminded that the loot, the recovered loot from the island of Jersey and from the United States, there are conditions attached to how that can be deployed. Because in the past, we've had this problem with the state governments where they just think, you know, everything must be shared, you know, out of a sense of entitlement. One of the things they also did yesterday was, yes, the Infectious Diseases Bill, they addressed it. And their suggestion is that the National Assembly should suspend it to give room for more consultation.
With them,
more so, as the bill as proposed has been very controversial. And I think it's not something that the House of Reps or the Senate should be emotional about. Because in the response, I saw some complaint about Governor Tambuwa, who brought up the issue at the meeting. This is not a personal thing. It's about public interest. And the National Assembly should have an open mind and be ready to take inputs from other stakeholders. The governors also yesterday congratulated the Chief of Staff, the new Chief of Staff, Professor Ibrahim Gambari. They also, you know, unanimously endorsed his appointment by the President. Now, they also talked about providing palliatives in their various states and also setting up the 300-bed facility that the Presidential Task Force had recommended every state should make sure they have.
Absolutely. A productive meeting, it seems that way. We'll go on a quick break now, and when we return, we'll be having our trio, Rota Sodiri, Michael Wilson, and Aaron Akerijola, here to give us updates on Africa and global business, and, of course, COVID-19. Stay with us. Welcome back. You're still watching The Morning Show here on Arise News.
Rotus Ojiri joins us now to give us a business update.
Good morning,
Good morning, Dr. Mate. Good morning, Leila. Yes, so the business community is celebrating Ekiti State this morning. Governor Fayemi, the governor, signed an executive order which essentially slashes their right-of-way charges by 96% from 4,500 naira per meter to 145 naira per meter. Right-of-way essentially is right-of-way charges are what internet companies or ISPs, internet service providers, would have to pay to lay a meter of broadband cable. So they put a tweet out yesterday. The Ekiti State government they sent out a tweet, announcing it on Twitter that this is what would be happening. That broadband penetration is coming to Ekiti State thanks to Governor Fayemi crashing the right-of-way charges from 4,000 naira to 145 naira. Why is this important? Now, I wanted us to take a look at the submarine cable system for Western Africa. We're going to be looking at an image of the cables that essentially provide internet from Western Africa to the rest of the world. And there are a lot of them, and it's essentially how we are able to get connected to the rest of the world when it comes to internet connectivity. So the submarine cable system, right, is important because Facebook just made an announcement. Yeah, there it is. So that's essentially all those colorful lines there. And essentially what's, starting from the base in Western Africa, take Western Africa pretty much around the world as far as internet connectivity is concerned. And it stretches pretty much around the continent. Now, Facebook made an announcement yesterday that they're building a 2-Africa internet infrastructure project. It's about 22,990 miles, which in kilometers about almost 37,000 kilometers undersea cables. I think it's going to cost about $1 billion. And they're working with China Mobile International, Vodafone, and Telkom Egypt in order to provide this massive infrastructure of undersea cables around Africa. It's a good initiative, but one of the issues that we have with internet connectivity is something called last mile connectivity. That's fiber connectivity to the office or fiber connectivity to the home. That is the last mile, the last end users getting it there. The cables are fine. All these projects are fantastic, but we need to get it there. One of the hindrances to getting last mile connectivity is the cost. The right-of-way charges are, really, really high. Dr. Issa Pantami, the Minister of the ICT and Digital Economy Minister, he's been pleading with the states to reduce their right-of-way charges because they're too high. And back in January, I think Lagos, some other states were some that were too high. So Ekiti State has led the way. They're first to do this. And what this is going to do, by reducing the charges, the right-of-way charges, you are incentivizing businesses to come in. The ripple effect is massive because telemedicine, education for students at home. So it's very, very impressive that they've done this. It is hoped that other states will follow suit. And the individual that really drove this was the special advisor to Governor Fayemi on investment and trade, Akin Oyebode. Hopefully, we're going to be talking to him on the Global Business Report about 11:15 this morning to get some more details on that. So it's a pretty good initiative for Ekiti. Yes, it is, and it's hopeful. This is capitalism in its purest form. This is how you attract business, you make your state attractive, and now I'm thinking the other states will hopefully follow through because they want to bring in the business, and the internet is everything, right? You need it for all this.
Charges have always been a problem, not just with the telcos trying to lay their cables, but even also for the construction of roads and all of that. And many state governments in Nigeria see right-of-way applications and charges as a way of generating revenue.
Yes.
But the opposite effect is that, there is delay in terms of infrastructure. There's a lot of obstruction. But now that Ekiti State has done this, it's a good development and it's commendable. The governor of Ekiti State is doing what he calls the Ekiti Knowledge Zone. And this is part of his administration's attempt to build a digital economy. Now, telcos have always complained about right-of-way charges. We hope that this will improve broadband penetration in Ekiti State, and with all the effects, the advantages that you have talked about. Now, previously, for 1 kilometer, you would need up to 4.5 million. Yes. Now, in Ekiti State, you just need 145,000 naira. Yes. However, 2 questions have been raised. Now, if the telcos find it easier to do business in Ekiti State, would they reduce charges? for the people of Ekiti State.
Okay.
And then secondly, does it not translate into the loss of revenue for the Ekiti State government?
Right.
But I guess, the
that
governor's
first question
vision
is very valid.
Right, it is. It's something to be looked at. But Ekiti plans on making up the revenue with the new business that will be coming in,
Exactly.
with the reduction and the attracting. And so we'll see how it works
Says
out.
thank you. Good news this morning.
Yes, thank you.
And now moving on for a more global business updates. Michael Wilson joins us from London. Good morning, Michael. How are you today?
Good morning, Michael.
Good. I'm very happy about your broadband initiative.
Sounds great.
I'm a great fan of broadband because obviously it gives me the great pleasure of being able to speak to you every morning, even though I have to occasionally step over the holes in the road that the doctor's just been talking about. But let's do this then. So the end of a week of very gloomy news, obviously. But China has come up with some industrial production figures which are slightly better than expected. Again, we always, take figures out of China with a pinch of salt, but they are up quite a little bit. Retail sales, as you would absolutely expect, are down in China. The extent of the worries in the equity markets over the week has given a bit of a boost to gold. European markets have tumbled. We talked yesterday, didn't we, about the possibility of perhaps a V-shaped recession or a U-shaped recession, and the United States is thinking more and more of a U-shaped recession, i.e. steep fall, bumping along the bottom and then up at some stage in the future. Where that will be, who on earth knows? But that's where we are right now. Overnight, the President of the United States, or rather late last night as far as UK, our time is concerned, your time and my time is concerned, another threat to China. Remember that in the background we're looking at the US-China trade talks and wondering how they're ever going to get to phase one about this. I think there's a lot of, and I mentioned this yesterday, a lot of calibration going on, if I can put it like that, between the relationships between the United Kingdom and China, the United States and China, and of course, not least of which, Africa and China as well. As you know, obviously, China is a massive investor into Africa, some $299 billion so far and still counting. That's going to be an interesting thing for the future. Talking about trade, the Deputy General of the World Trade Organization is leaving a year early, citing one, pressure from big members like the United States, and secondly, the collapse of their higher court. That doesn't bode terribly well. It must be very difficult having a major economy like the United States constantly biting at your ankles. The World Trade Organization is saying that actually, if it weren't for the World Trade Organization, it would be like bandits out there, but we'll see. In the United States, again, here's a societal change for you. It's a very interesting statistic, this, that actually renewables are going to take over from coal for the first time in history, obviously because renewables are relatively new, in terms of domestic power. Solar panel costs are down 80% over the past decade, and the cost of building a wind farm is down about 25%. So you can see there's a shift there. And obviously the increase of fracking and the way in which costs of fracking actually reduce are actually helping liquefied gas. Oil slightly up today, but we'll be very suspicious about that. It's only on a day-to-day kind of thing. Copper, here's a good one. My favourite, Dr. Copper. This is a good indicator of where the economies are actually going. And the biggest EU producer of copper, Al Rubik, has said that yes, its quarterly profits are down, but its forecasts are up. Today, a busy day, US retail sales and also New York federal industrial production. That's a big one. That'll drop extraordinarily. Listen, we're coming up to a weekend, we hope, of a bit of prayer, a bit of holding hands, and a bit of taking stock over what's been a very, very bad week. No bad time to have a weekend and to think sensibly, if we can, about what's been going on.
Michael, thank you.
Well, thank you very much, Michael Wilson.
Definitely. And now for a more, or rather, COVID-19 update. Aaron Akirejala joins us now. Good morning, Aaron. How are you?
Good morning, Leila.
Good morning.
Good morning, Doctor. As we always say, thank you. This Friday.
Honestly, TGIF, TGIF.
Yeah, okay. But although it's still social distancing is still going on.
Yeah.
Regardless, so certainly those who decide to probably party a little bit might actually get a little bit stick from the law. But in the meantime, let's actually tell you that the World Health Organization regional office have actually published a report in the BMJ Global Health that says that 190,000 deaths is expected in the next 1 year, which is good news, because they are claiming that this will be the lowest from continent by continent assessments, looking at the Asians, looking at South America, looking at North America, and looking at other regions, that Africa will likely have the lowest figures. As of this morning, of course, the number of cases are 75,447, which is actually close to the 190,000, and just 2,556 deaths and 27,227. And the report goes on to even state that, looking at how things have actually played out, that a lot of people have been talking about the fact that not so much testing has been done in Africa, but South Africa is a very key example of the fact that a lot of tests have been done in Africa. Well over 12,000 tests have been done in South Africa. And when you look at the number of deaths that have actually resulted from the infections and the rest of them,
12,000 or 112,000?
The 12,000 have 112,000 with 12,000 cases in South Africa right now. So you look at all these things and they say that Africa, it's looking like things would actually work in our favor. And one of them being that the median age in Africa certainly has always been one to actually celebrate. The fact that we have more youth in Africa certainly will mean that the virus will not spread as much as possible. And also the level of obesity and some other illnesses certainly that are not too prevalent in Africa. We have them in Africa, but not as much as the US and the UK and some other regions certainly will also help in ensuring that these viruses do not take a toll on the body as much as it would in other regions. Well, I don't know whether we should be so optimistic, because WHO just released a report in which they say about 250 million people could die, could be infected in Africa, and over 190,000 could die.
Coupled with other diseases as well.
Thank you, Aaron.